Hello, sir. Good afternoon.
Hello, good afternoon.
How are you?
Yes, it was a busy day today, but it's fine. Today we'll have some question and answers for the normal public. I'm Dr. Bhavin Mandowara. I'm a nephrologist.
Okay. Thank you so much, sir, for the introduction. Can we start?
Yes.
What inspired you to start your journey as a nephrologist?
So basically, in the early years of my practice, I had noticed that the patient used to come very late when the disease was almost irreversible.
Oh.
So my main target was to detect the kidney problem earlier, so that the patient do not land up on dialysis.
Right.
So with this key factor, I started my Krishna Kidney Centre in Vadodara.
Right, sir. Good. With over a decade of experience, what the key factors have contributed to your success as a nephrologist?
So if you talk about what are the reasons behind my success, I would like to say that I see the patient as a whole. I don't just read the reports, I see the person behind the report.
Right.
I try to evaluate what had landed to his condition. I try to go in depth about the reason for his problems. And I believe in educating the patients also a bit so that they understand their diseases. So it has a better outcome on the treatment also.
Right.
So the basic empathy towards the patient, you have to understand the patient as a whole. That is my main reason for my success.
Right, sir. What are the most common kidney problem you see?
So kidney common problems, if you talk about the kidney diseases, remains the same worldwide. And the most common problem is the diabetes. Diabetes contributes to almost 50% of the chronic kidney disease patients. Following that, hypertension related kidney disease, renal stones, and some kidney disease such as the glomerulonephritis, and yes, urinary tract infection. So these are the 4 or the 5 most common problems which I encounter on day-to-day practices.
Okay, right, sir. So is really important to early detection of kidney disease?
Yeah, that's the key problem that kidney disease has, because until almost 80% of the kidney is not damaged, the patient does not have any physical problems. So early detection is the key, because in the early stage of the kidney disease, the patient will not have any problems.
Okay.
And when later on almost the damage has been done, he will start having symptoms such as he will have fatigability and he will have frothing in the urine. He might have breathlessness on walking. So these are the common symptoms which occur later in the course of the disease.
Right. Can you share a challenging or tough cases you have handled?
Oh, there are a lot of that, but one of the interesting cases recently I have encountered is that there was a young patient who was just 28 years old, and he had rapidly, once his condition deteriorated, he had decrease in the urine levels, he had breathlessness on walking, and his reports were suggestive of rapidly decreasing of the kidney function.
Okay.
So fortunately, he presented early, means not so late. Within a span of 1 or 2 weeks only, he presented to us. We did his renal biopsy, and we started with aggressive form of treatment in the form of plasma exchange, and gave him medications. And fortunately, he responded to that and he improved. He needed a few dialysis, but following that, with the help of medications, we could switch off his dialysis, and currently he is absolutely fine without any symptoms related to kidney disease. Yes, though he will need lifeline medications, but the important thing is that early detection is the key. Right. Because of that, we could prevent him from landing on dialysis for his lifetime, just because he presented early, and we could treat him nicely.
Interesting, sir. So how technology helping in kidney treatment today?
Technology actually helps just to means the diagnosis of the patients, and today also it remains a clinical judgment of the doctor. We usually examine the patient and make a clinical judgment what could be his problem. So this technology helps us in making our diagnosis satisfactory, if it is right or not. And technology also comes with a good handsome cost also. Right. So we cannot always take the advantage of technology due to many concerns. But yes, technology has advanced. We are now able to detect the kidney disease earlier, We are able to classify the kidney disease on many aspects, and it has helped in early detection as well in treatment also.
Right, sir. How did you stay updated with the new advancement?
So that is really important. So healthcare is a rapidly evolving field. There are new researches which time to time gets published internationally. So we have to stay updated. We have to give the best possible
Right.
updated treatment to the patients.
Right.
So we usually read the research articles which are available online also. We have quarterly conferences, national as well as international conferences, peer groups and everything. So we stay updated with the help of this research and the newer medications and the advanced forms of treatment.
Okay. So, what early sign of kidney problems should people watch for it?
Yeah, that is a very really important problem. So the early symptoms which I would say which appears in the kidney disease includes the waking up at the bedtime. If you have to wake up more than 2 times in the bedtime after sleeping, that means that there is some issue with the kidney. After having a good sleep also, if in the morning you are feeling fatigued, that could be a sign of kidney disease. And lastly, if you are having edema in the legs, if you see the swelling in the legs,
Right.
or frothing in the urine, these are the signs of kidney disease which should be you look for, and if you detect early, we can prevent the kidney disease from progressing.
Okay. So these are the important signs people have to watch.
Yes, definitely they should and means reach to the healthcare to prevent further progress of the disease.
Okay. What do you love most about your career?
As a profession, as a nephrologist, I would say that whenever the patient, after giving the treatment, he feels improvement and says thank you to us, and he is very satisfied after the treatment, it feels very good to us. Means we think that we have made some difference in the society. We could help a family, not just a patient,
Yes,
as a
yes, of
family
course.
as a whole. So that emotional as well as empathetic treatment helps us in motivating for further good care and support to the further patients and the families.
Right, sir. Thank you so much for the answer. What are your future plan for your center?
Yes, so basic, my first and the foremost priority, which I had started with the same target, that I want to detect the disease earlier. I wish that patient detects their problem. I wish to stop the dialysis from happening. That is
Right.
my main aim. And if at all he is on dialysis, I would give him a good quality of life, if possible with a transplant or with dialysis also.
Right.
So I want a good quality of life, if without dialysis or with a renal transplant. That is my main target.
It's very important, right, sir? What impact has your 3 best rated listing had on your entire center visibility and customer trust?
Yes, so first of all, I'm very thankful that I have been reviewed as a 3 best nephrologist in Vadodara.
Right.
So it indirectly determines that the patient has trust in us, and we are doing good. And it also helps in just increasing the visibility and just telling the society as well as the patients that there is a good doctor team here and a center here, so they can take the advantage of these facilities. And in the near future, I would start a preventive kidney care programs to detect the kidney disease early and prevent it from progressing further.
Thank you so much, sir, for sharing your knowledge, and thank you so much, sir, for your time.